everyone, myself Dr. Priyanka and I'm one of your mentors for study MRCPI. So today we'll be discussing for the MRCPI part 2 written, the AAA series. We'll be discussing a topic, very important topic on cervical screening Irish guideline. Okay. So according to the Irish cervical guidelines, so who are eligible women for having the cervical screening? Okay, so the eligibility criteria, the age criteria is between 25 to 65 years. So those who fall between 25 to 65 years must have the cervical screening test. And from 2020 in Ireland, first previously it was by the smear cytology, but from 2020 it has been replaced by the HPV testing, which is the primary test for cervical screening in Ireland. So from 25 to 29 years, when we start from the first invitation, that is from 25 years, so it is till 29 years, the cervical screening is done every 3 yearly. And once the woman achieves is 30 years old, till the age of 65 years, it is done every 5 yearly. Okay, so this is very important point regarding the exam. So just let me do the pointer options. Okay. So here, when we start from 25 years till 29 years, it is done every 3 yearly. And from 30 years to 65 years, it is done every 5 yearly. So if at first, if the first HPV test is positive, then we do a cytology, the cervical smear cytology. And depending upon that result, so if the cervical cytology is negative, but the HPV was positive, we call the woman again after 12 months, that is 1 year, and we then repeat again the HPV test. But then on repeat testing, if the HPV test is negative, if the HPV test is positive, then regardless of the cervical smear cytology, we refer them for colposcopy. Then if the first the test, HPV test was positive, and the cervical smear came as ascus, that is the cells of uncertain significance. Okay, so then in that case we will refer the patient directly to colposcopy. Sometimes we may get result like unsatisfactory or inadequate smear. So in that case we repeat the test again in 3 months. So as we know that the cervical intraepithelial neoplasia, that is a precursor for cervical carcinoma, and almost 70 to 80% of the cervical carcinomas are the squamous cell carcinomas, and most of the carcinomas are due to the high risk HPV types caused by them. So what are the high risk HPV types? That is the oncogenic subtypes. So the most common are the 16, 18, followed by 31, 33, 35, and other 9 oncogenic subtypes. So these are the ones who are have been known to have caused the relation between them and the cervical carcinoma. So here, as I said, from 2020, the primary cervical screening test in Ireland has been shifted from cytology to the HPV testing, that is a molecular test. Then why it has been shifted? Because it has the increased sensitivity than the normal cervical smear cytology for the high grade cell changes, and also the accuracy is higher, the variability is lower, and it has better reproducibility and high negative predictive values. So here, the patient can also do own HPV testing when they are given the kit, HPV kit, as you can see here, and then they can they should only touch the tip of the cover of the probe, and then they need to insert and rotate it for 10 to 20 seconds, and then in a special medium it is inserted, and then it is posted to the proper respective department. So here, according to the cervical check guideline, when the patient is 25 years old, then they will receive the cervical smear invitation, the cervical examination invitation. So first is the HPV test that is done. Okay, so depending upon the HPV result, as I said, if it is the first HPV result is positive, then a cervical smear is done. If the cervical smear shows ascus, that is, if the patient is both HPV positive plus the cytology shows ascus, then the patient is referred directly to colposcopy. But if the high risk HPV is positive, and then the cytology is shows negative, then the patient is called after 12 months, after which again the high risk HPV is repeated. And if the high risk HPV after 12 months comes positive, then the patient is referred to colposcopy directly, even if regardless of the cytology result. And If the high-risk HPV comes negative at first visit, then the patient is called routine recall. What is the routine recall? As we saw in the previous slides, if they fall between 25 to 29 years, it is every 3 yearly, and from 30 years till 65 years, it is every 5 yearly. So again, if the HR-HPV after 12 months, which was repeated, if it is negative again, so in that case also the patient is called routinely. Okay. So here, this is an important slide here. If the HR-HPV is not detected, and the screen, when we can call that the screening is complete, when the patient achieves the age of 61 years, because we know from the age of 30 years till 65 years, it is done every 5 yearly. So once the patient achieves 61 years, her screening we can say is complete, because her next screening test would be 66 years when it is not done. So the maximum age limit for cervical screening in Ireland is 65 years. So in them, the screening is complete. Or if the patient has undergone a total hysterectomy, not for CIN reasons, so in that also, it is considered that the screening is complete. They do not require any increased surveillance for cervical smears, HPV testing. Then who we will call every yearly if they have HPV negative test? Those who are having a high risk of developing a cervical carcinoma, like those who are having immunocompromised state, like HIV positive people, or those who are having undergone renal transplant or renal failure. In them, we will call them yearly, that is annually, even if their HPV test is negative. For 3 year recall, as we went through, for those who are between 25 to 29 years, we will call them every 3 yearly. And for 5 yearly, we will call those who are falling between 30 to 65 years. Okay. So the recent one is 65 years. So if the result is indeterminate or inadequate, in that case, we will repeat the HPV test after 3 months. And sometimes we may get that the repeat testing is also indeterminate or inadequate. So if the first and second consecutive tests are showing as an indeterminate or inadequate result, in that case, we will do a third consecutive HPV testing. But even if the third consecutive HPV testing shows inadequate or indeterminate result, in that case, then we will refer the patient to colposcopy if all the three consecutive results show as indeterminate. And also, when the test is not processed, in that case also we repeat after 3 months. And if that HPV is detected, so HPV is positive, then if previously it was unsatisfactory, we will repeat it after 3 months. And we will call yearly. So if 1 year recall for those who are HPV positive and they were cytology negative, as we went through the previous slide. So the first HPV was positive, but then the cervical smear was negative. Then we will call them after 1 year and repeat the high risk HPV. And depending upon that, if the repeat high risk HPV is positive, then regardless of the cytology, as I said, they should undergo colposcopy. Then you will refer directly to colposcopy. So if they have the second consecutive HPV positive result and the cytology is negative. So regardless of the cytology result, if second HPV is positive after 12 months, we refer them to colposcopy. And any test, not if any one high risk HPV, one test is positive in an HIV positive woman, we do not wait till 12 months to repeat the high risk HPV. We directly refer them to the colposcopy. In an HIV positive woman, only one result is enough of the high risk HPV to be positive, and then we refer them to the colposcopy. Also, in those who are having ascus and those who had HPV positive status also, HPV, so in them also we refer them to the colposcopy. So what are the recommendations for those who are having cervical screening in pregnancy? So those who did not had any previous screening before, or those who had negative screening, the negative cervical smears before getting pregnant. So the next smear, it can be deferred until 3 months of postnatal period after delivery. But if the previous screening, the previous test was HPV positive, and then the cytology was repeated, which cytology was done, which was negative, then they should be called after 1 year. That is like a routine recall, which we do after 12 months and do the HPV, or they can be called 3 months postnatal or after a miscarriage. But then if when they are pregnant and both the HPV and cytology were positive before the pregnancy, then they should be referred to colposcopy then and there, irrespective of the trimester. And if they had received the invitation that they had been referred to colposcopy for because of the previous positive results, then they should undergo the colposcopy then and there. And when can be when it can be deferred in after a pregnancy or a miscarriage period. So after delivery or miscarriage, it can be done deferred until 3 months of miscarriage. So what are the recommendations for women who have never been sexually active? Because we know once the sexual activity is achieved, the risk of acquiring HPV infection increases. So what is the recommendation till for those who have not achieved? So they should be counseled that the risk of acquiring HPV is low until they are sexually inactive. But once they become sexually active, they should be requiring cervical screening test. That is the recommendation that should be started in Ireland. And also the cervical screening recommendation does not differ for those women who have sex with the woman. Okay. And those who do not want to be participating in this cervical screening program, so an opt-out form should be filled by them, and it should be posted. Also, the woman's sexuality, whether she is heterosexual or homosexual, it should not be documented on the cervical screening form. So regarding the cervical screening for those who had a post-pelvic radiotherapy, so we know that radiotherapy can cause fibrosis, it can cause narrowing, and also it can cause ulceration and obliteration of the cervix, and which may make the examination quite difficult, the high-risk HPV testing quite difficult. So hence the Irish recommendation is that the cervical screening is not recommended in those who have undergone pelvic radiotherapy, because it would be difficult to perform the examination itself, and hence because it is difficult, it would be difficult to interpret the result, and also there can be false positive or a false negative result that can happen. So for those who had a total hysterectomy, so for them cervical screening is not recommended. But if they had undergone total hysterectomy for a cervical intraepithelial neoplasia, so for them they should have continued their cervical screening program as per the schedule and as per their age. And those who have undergone subtotal hysterectomy, so we know that the cervix is intact in them, and for them the routine cervical screening is recommended. Now, recommendations for the immunosuppressed women, like those who live with HIV, or those who had a renal transplant, or have required dialysis. So for them, the recommendation is to do an annual HPV testing. Since in HIV positive women, since they are diagnosed with HIV, they should receive cervical cytology, the HPV invitation every yearly. And if only one test of a high-risk HPV is positive in them, in HIV positive patients, then they should be directly referred for colposcopy, not to repeat again. And in patients, those who require dialysis, or those who have undergone renal transplant, or and they are post-transplant, they should also receive the HPV testing annually. And also, if there are some women those who are on cytotoxic medications, or chemo, or biologic agents, in them it should be a routine the HPV testing, and not the annual one. This is the recommendation by the Irish guideline. So thank you so much, guys, for attending. Thank you.